Well, the first step of introducing these tests is difficult. The patient has been diagnosed with a cancer diagnosis, and there's a lot of anxiety and stress surrounding the situation. And it's important for patients to understand that this is not auxiliary information that may be nice to have, but not that important, but that it's really a key factor in deciding their treatment steps. So I urge patients to give their best shot at patients, to have the endurance to wait 2 weeks for a comprehensive genomic profiling test to come back and help us steer their therapies. I always tell them we can always start something, but you want to start the best therapy first. I believe that's the most optimal way. I find that for most patients this is effective. Sometimes we run into the scenario that a patient is highly symptomatic. We may have to start a more generalized treatment, like a chemotherapy or radiation therapy at the beginning of their treatment course to alleviate symptoms. But at the earliest possible moment, I would like to switch to the most optimal therapy. The availability of the next generation sequencing profile is important. In these settings, I oftentimes choose an approach where I use a liquid biopsy test in addition to a tissue-based test to accelerate the turnaround time and allow me to introduce appropriate therapy steps earlier. It's not fully accepted yet in the community, but I think in certain clinical scenarios, it's highly helpful to make sure that the patient receives the most optimal therapies. But it is a discussion in the beginning. I think it's important to tell patients that they have the potential to live longer, and that they also have the potential to live a better life, a better quality of life with appropriate matched therapy. I think this makes sense if you know what you're treating, that you have a better treatment course, a better treatment outcome. But it's something that has to be relayed in the beginning. And we oftentimes have treated next generation sequencing as an adjunct information, and it really is the core of the information pieces that we should be having. And in some cases, in my opinion, the molecular information actually outweighs the importance of the histological information. So it's truly not dispensable information and should be available before any treatment decision is made.